We are updating tonight's top stories as Singapore approves the Pfizer-BioNTech COVID-19 vaccines. The first batch will arrive by the end of the month. Vaccinations will be free for all Singaporeans and long-term residents. At the same time, the country will enter phase 3 of reopening in 2 weeks. Groups of up to 8 people will be allowed. Well, let's continue our discussion on that topic. And for more, we're joined by Dr. Leong Hoe Nam from the Rophi Clinic at Mount Elizabeth Novena Specialist Centre. Dr. Leong, we heard earlier about a very strict vetting process that that the vaccines had to go through. So I'm wondering, in that process, what were the considerations that the HSA would have looked into prior to approving the Pfizer vaccines for use here?
HSA will be staffed by people like you and me, Singaporeans, doctors and pharmacists. So they are actually concerned about the vaccine as much as you and I are. We are concerned about, is it safe for our brothers or sisters, our fellow Singaporeans? So look at the molecules that are involved in the whole vaccine, the different constituents of it, how are they manufactured, the safety of it, the purity of it, and at the end of it all, the final outcome product, is it a safe thing? We also look at the vaccines in terms of efficacy. Is it effective in what it's said to be? And what are the potential side effects? And mind you, this is a vaccine that's been rather short in development. So we don't have long-term data, but at least in terms of short-term data, what are the side effects that are seen? Is there any particular risk to Singaporeans, to Asians? Are Asians adequately studied in this vaccine? So these are the very questions which HSA will put to themselves. When they ask themselves honestly, is this safe enough for myself, for my siblings, and my fellow Singaporeans?
Dr. Leong, Pfizer-BioNTech was approved under interim authorization for pandemic supply from HSA. How is that different, or that approval process different from what was already being done to ensure safety is not compromised?
Well, one thing that's clearly lacking is the long-term safety data. You want to know if the vaccine is, after given, how long does it last, what are the potential side effects. If the potential side effects happen 2 months later, 3 months later, or even a year later, what happens? Do you need a second dose and third dose? So that is what's lacking. So in terms of approval, this is a rather short life. Usually we're used to drugs, which is at least been around for 3 years to 5 years, at least in terms of development. So much shorter, we don't have long-term safety data. Hence, it is put as emergency because we are trying to get it approved for use as quickly as possible to try to save lives. Which means if more data comes along later and is proven to be more effective, it goes on, it's proven to have safety issues, it's not suitable for everyone, then there will be control as to the use of the vaccine. So it's not a one-time full approval, but conditional, because of the unusual circumstances.
The multi-ministry task force didn't give an exact number, but they said the higher the better, and I'm referring to the percentage of the population that they'd like to be vaccinated for Singapore to become really protected against COVID-19. What do you think that figure should be for it to be effective, and how long do you think the vaccines will take to kick in?
All of us think that figure should be about 2/3. So we're talking about 65, 70% to 80%. I'm an optimist. I want 80%. The bigger the number, the better the herd immunity, then the least then cases will fall through the cracks. So how long will it take to have it implemented? It really depends on how fast the vaccines come. As you learned from the Prime Minister, we've ordered from 3 different manufacturers, that are Pfizer, that are Novena, as well as Sinovac. And apparently, it's going to take until the 3rd quarter of next year before the bulk of Singaporeans are vaccinated. So it's going to take a long time. It's going to take a long lead time. And one question I want to just remind the viewers is, we do not know how long the vaccine will last. I think it should last for at least 1 to 2 years, minimum. But we don't really know, and only time will tell. Now, the good news for us Singaporeans, I'm very practical here, our British counterparts are getting the vaccines now. So that's in December. In about 1 to 2 months, next month you're going to get it. At least we will see the 1 month experience of a large-scale use among the British counterparts.
And Dr. Leong, the vaccine is not recommended for pregnant women. Who else should perhaps be concerned? And will you be yourself signing up to get the vaccine?
I'll sign up for the vaccine. I think it's fine. I've gone through the scientific data for it. I'm actually quite pleased and happy that from what I can see, this is actually a very safe and efficacious vaccine. I would sign up. I would even do it live on TV if I have to. If it's to encourage my Singaporeans to go ahead and get it, I would. Now, who are the people who should not get the vaccine? The study has been done for 60 years old to even someone who's about 90 years old, and half of them have chronic illnesses of some sort, from diabetes to ischemic heart disease, heart failure, stroke, etc., which means that it's actually suitable for the bulk of the people. The only exception will be the young children, those who are less than 16 years old, and the pregnant women. We have no idea if it's safe. I think theoretically it should be fine, but we still want to see safety data. Give it to 1,000, 10,000 children, or a smaller number in pregnant women, and if there are no issues in terms of the fetus who are born to babies and healthy babies, then we should carry on with the children and the pregnant women. So in short, anyone who's 60 years old and above, go for it. If you're not pregnant, go for it. And if you want to get pregnant, go for it before you try pregnancy.
All right, thank you very much for that advice, Dr. Leong Hoe Nam from the Rophi Clinic at Mount Elizabeth Novena Specialist Centre.